recording? Alright, so today I'll be giving a presentation on CPR. For those of you that do not know, CPR stands for cardiopulmonary resuscitation, or mostly commonly known as mouth-to-mouth. Now, for CPR, it's very good in emergency situations whenever you have cardiac failure. And the things you'll need is, obviously, one is a CPR mask. You can buy these on American Red Cross, and it comes with one CPR mask with a one-way valve and a face strap. Oh Lord, and a face strap, and sterile. Make sure it's sterile, or else you could cause infection and it could lead to serious things. And also, you don't want to spread diseases between you and everyone else. And alcohol swab your mask after you're done. Now, the first steps in CPR is what? Vigilance. Scene assessment. You see somebody fall out, hearts, they have a heart attack, they fall out, that's when CPR starts immediately. You see the scene, if it's just you automatically, you check the scene safety, make sure the scene is safe for you and your patient. So that way when you walk up to perform CPR, you don't want anything that could harm you or your patient. And then the second step is to go ahead and call emergency. Whether it's you by yourself and you have to call and put them on speakerphone and you start CPR, or you tell somebody, hey, call 911. And then the next step for CPR is you're gonna check for pulse and breathing. And to check for a pulse, you're gonna take two fingers. You can check it on your wrist or in your jugular, right perpendicular to your jawline, right underneath the jawline. You should feel a pulse. And if you do not feel a pulse, then you need to start doing chest compressions. And you also need to check breathing. And if they're not breathing, you should start with chest compressions as well. Now, when starting chest compressions, placement and technique is very important. First step, you're going to take your dominant hand, so whichever hand you write with or anything else, you take your dominant hand and you're going to place it flush against their chest. It doesn't matter which side you're on, left or right, as long as you use your dominant hand. You're going to press it flush right in the sternum, right in the center in between your nipples. And then you're going to take your weak hand and you're going to interlock them into your dominant hand and press up against the sternum. And when you start chest compressions, you're going to want to make sure you have your elbows locked, and you're going to want to push down at least 2 inches. And when you do CPR correctly, sometimes you'll hear you'll hear ribs cracking. And although it is not a very good sound, it's a very small price to pay when someone's in cardiac arrest. And you're going to want to do 30 compressions and then 2 breaths. Now, your compressions, you should do at least 100 to 110 compressions a minute. And this is most commonly paced by the song Staying Alive from Saturday Night Fever, John Travolta. No? You're going to want to do that. So after 30 compressions, you're going to want to count out loud to help keep track. After 30 compressions, you're going to take your patient and you're going to tilt their head back to open the airway. And you're going to take your face mask and put it over their face and make sure that this face mask covers their nose, and you're going to want to place down on top of it and blow into the one-way valve. And as you blow, you're going to want to look down and see their chest. If their chest starts to rise, that means that you're doing it correctly. And you're going to want to do this until medical assistance arrives or they become conscious again. And after 2 minutes of compressions and breaths, you should check for breathing and pulse. And if there is a breathing and pulse, then you wait for emergency vehicles to get there. And if there's not, you keep going. Now, you're going to get very tired while doing this because it takes a lot of effort. So if you're not alone and somebody else knows how to do CPR, you should definitely get them to help swap, and you can switch out between breaths and compressions. And also, when performing CPR, you want to always check up on your state laws for Good Samaritan law, because if your state does not fall under Good Samaritan laws, you can fall under a lot of legal trouble if that person ends up dying or injured with like broken ribs or anything like that, or sickness from what you gave them while performing this task. And if you look on your handout, you'll see websites. You can go on American Cross, you can go on American Heart, all these different websites, and you can read up on these things, and also you can keep the pamphlet that I